I thought it involved like giving medications, being an advocate for a patient, spending time, 12 hours with a patient.
I didn't know much about healthcare. I had had very little interaction with it.
I thought it involved caring for people, taking the best care of them that I could have.
I really just wanted to work in a school as a nurse. I thought the hours were easy. I thought it was an easy job.
I saw nursing as a bedside nurse, doing the assessments, caring for the patient.
I love working at Primary Children's because I just love the patients.
I had no clue I'd end up where I am at this point in my career.
The more I've grown into my career, I've realized what those things actually entail.
Nursing evolves, and that's the opportunity with nursing. You can do so many different aspects.
For me, it's the feeling of walking through the front door, knowing that everybody that's here has that same mission, vision, value, the child first and always. My name is Karen Talbot. I'm the Assistant Nurse Manager for the Children's Medical Unit. I became a nurse because of the excitement. I started as a floor nurse 12 years ago, and then I progressed into a charge nurse, and then I found a better path that I thought better suited me, and that was taking care of the staff on our unit and ensuring that the families get well taken care of. I love nursing because of all the interactions that take place between people. You're able to get down and talk with those families in their moments where they need you the most, and they depend on you, they trust you. They want you to be able to care for them the way they would if they could. About a week before he was diagnosed, he had one episode of vomiting, one night of a fever, and then the night that we came in, he had excruciating abdominal pain. I remember my husband and I sitting there, and you're in the gurney, very, very sick, very pale, and about 6 physicians all walked in and gave us the diagnosis. He has Burkitt's lymphoma, and then as soon as you hear lymphoma, that's when it really hits you, and I just dropped to my knees. Because being here at primaries, you see these kids walking around, and it's almost like we feel as employees here we're invincible to these diagnoses. And when your own child gets diagnosed with something, that's when it really hits you.
Nursing is my second career. I started out engineering. Kids are different. Kids need someone to protect them. They come with an innocence. I do a lot of different things in this unit. I wear a lot of different hats. I'm a charge nurse. I'm also one of the coordinators for the ECMO program. So all my days are totally different. Primary Children's is a unique place to work. They give me the tools to provide like high-level safe care, and they really stand behind us in that. The education I received here is amazing. I hope the future nurses come out with a good tool set. I hope they have a good, strong work ethic, and I hope they're caring. I hope they take nursing seriously. It's a unique career. It's a noble career.
My name is Quincy McGuire, and I'm a float pool nurse here at Primary Children's, and I've worked here for over 2.5 years. I remember the first time I walked into Primary Children's for my clinicals. It was 6:30 in the morning, and I just felt this electricity as I walked through the front doors, and from that moment, I fell in love with this hospital, and I fell in love with the pediatric population. During my initial orientation to the float pool, I learned how to work on all of the different units here in the hospital. My job is unique because I get to work with lots of different patient populations, also a lot of different people in the hospital. I feel like I have not just one central unit, but I have a whole family here at the hospital on every single unit. In the float pool, we can get advanced skills on some of the different units, and so I've been trained in chemotherapy administration. I've been trained on the ventilators and drips here in the PICU, and I've also learned how to work in the emergency room. So one of the things I love about nursing is the opportunity for learning. The float pool has really afforded me an opportunity to continue my education. I've also decided to go back to school and get my nurse practitioner degree. Part of that will be made possible through the tuition reimbursement that Primary Children's offers.
I started out at Primary Children's as a pediatric intensive care nurse. I had been there for quite some time, but seeing that maybe change was needed, wanting to see a different aspect of nursing. What a case manager is, we advocate for the patients and their families. We interact with all members of the interdisciplinary team. Our main goal is to make sure that they have a safe transition from hospital to home.
I've been at Primary Children's since April Fool's Day in 1989. I think Primary Children's is just such a special place. You know, the first time I came in here, I could just feel it in the air. There is something in the atmosphere here. People care. We work as a great team. It is a fabulous place to be a nurse. What I enjoy about my job now, being the Chief Nursing Officer, is that I like to watch people progress. I like to see nurses who are brand new nurses gaining more skill in the types of patients that they take care of, and watching them grow and just become better nurses. We have lots of opportunities for nurses at Primary Children's. Some of it is at the bedside, but you can also become a case manager. We have transplant coordinators as a profession for nurses. We also have things like our family advocacy nurses. We're a full-service children's hospital. We provide care to all sorts of patients, those with strange diagnoses that there are very few of in the world. We do all sorts of surgical interventions on children. We are a level 1 trauma center. I think about the child first and always in everything I do. When I have to make tough decisions, when our team has to make tough decisions, we think about the child.
I'm Cameron Talbot and I'm 9 years old. I had Burkitt's lymphoma caused by Epstein-Barr virus.
Everybody, they all said, "You need to be mom. Let us take care of this." And that was comforting. I knew he was going to be taken care of to the best of their abilities in each of their roles. When I was on the floor 12 years ago, I floated up to the ICS unit twice, and I'll never forget those days. And now, as I pass all our nurses and our techs in the hall, I tell them, I know why you're on that unit now. I get it. I knew that everyone walking through that door had his best interest in mind.
When you're a nurse, just try your best.
Even though that can be draining at times, it's really a privilege to be able to give my all in helping others.
I love being a nurse just because I love to see people at the most vulnerable time in their lives, and that they actually do well. The kids get better, they go home, and they get to lead normal lives.
I love being a nurse, the service and what I can do to be able to help others.
You make a difference. Every day you make a difference in somebody's life. And it's not just the patient, it's the family. You make a difference in the family's life.
I truly think that's what nursing is about. Like, what if I was laying in that bed? What would I want people to do for me? And in pediatrics, that's what you get to do with these kids. You get to put yourself in their shoes, but also the family's shoes. If you are looking for a career in pediatrics, Primary Children's Hospital is the place to be.